You name it, I was a jack of all trades. Shipping clerk, loading trucks and stuff like that.
I was a breakfast cook, a truck driver. I drove for North American van lines.
After I became a widow, I went back to school and got my GED. I was supporting myself and volunteering all at the same time. My monthly income is $743.
I've got one sister that I depend on for support if I need it. Otherwise, I'm on my own. Health, that's the biggest challenge to me right now.
Well, the aches and pains come when you retire and when you get older, but I try for it not to bother me as much. I like to stay busy.
I don't like it. I'd rather be younger and can go and do what I used to do. Can't anymore. That's hard.
I'm 80 years old. Sometimes I feel like I'm 100, and other times I feel pretty good. I thought, well, I'll always have enough to get by on, but I found out that isn't true.
Most of the population that we deal with are people that were hardworking and expected to be able to survive on Social Security and are faced with very difficult decisions about medicine or food and how do I access resources. Our health system has gotten very complicated and people really have much more challenging situations to face and less support. We have a continuum of care. Our nurses go in and do the health promotion clinics and find out what are the issues people are dealing with and helps them understand what doctors are saying and ask questions that are appropriate to their care, and is an advocate in both the medical situation and the social services situation. And then we have the nurse care management program, which addresses the more serious problems and helps people access health care in a way that's outside of the clinic, does a complete assessment on them, helps them access resources, addresses the psycho-spiritual and the emotional issues, interfaces with family, with agencies, with doctors. When you walk down certain streets and see one of the low-income high-rise buildings, unless you're in the building and you've visited some of these people, you don't know the issues they're facing and you don't know what challenges they have.
We try to get by every month on what we get. Sometimes you have to stretch it a little bit, quite a bit sometimes. I'm hoping and praying that I can get a nurse because it's kind of hard to do it myself.
I try to encourage people to come down for HealthSET because a lot of them won't go to the doctor.
It does help the seniors find out if they have medical problems which they may have never even thought of.
I forget things, I do, but I'm trying to exercise 4 times a week because they say that's good for the brain, and then I study every morning for 1 hour.
It helps all of us, and you never know when you're going to need help.
Well, I donate $10 a month. It's not very much, but I do this because they're always there when you need them. So we gotta have them here every month. We got to.
Yeah, I donate to HealthSET. Sometimes I send as much as $25 to them in the mail. It's very worthwhile, is all I can say.
The program is vital for these people, and without it, the people would be standing in line for the emergency rooms and certainly would not have the quality of life which we help them achieve. They're deeply appreciative of all you do, however small it is.
There's a lot of things you don't know, and you haven't never been this age before. I think it's a matter of life and death because they give you encouragement to don't give up. I just really think God sent them to us.